Hi, welcome to Wagner. Welcome back to the Puck Building and events in person. By the turnout, I can see that you missed us. Yes? Yes? With us in the room tonight are brand new members of the Wagner community, students in our online MHA program. Join me in giving them a very warm welcome to the Wagner community. All right, so I am Carla Sampson, the Academic Director of Health Programs here at Wagner, our online MHA, as well as our on-campus programs, a Master's in Health Policy and Management and many specializations. And one of the things that we do here, really, we're preparing students to do the things, to have an impact, to translate those great ideas into action. And so tonight, we're kicking off what I think will be an annual conversation around one of the most wicked problems as we think about the delivery of healthcare, which is a perfect fit for who we are at Wagner, which is thinking about what do we do, how do we get to health equity. And so I would like to introduce our conversants. First, a man who needs no introduction in the city of New York, Mayor Bill, who is now this year, Professor Bill, who was selected as this year's Marnold Fellow, and he is teaching a course, Topics in Public Policy, really about, I jokingly thought when I saw the name, I thought about how the sausage gets made. Really, how do we achieve the changes that we need to achieve at the intersection of government and politics? There's a lot to learn there and a lot to learn from Mayor Bill in his term. He will be talking to a Wagner alum. I will not give away the year, but Dr. Moses Mansu is the program director at NYU Langone's Institute for Excellence in Health Equity. I know that there's a lot we want to talk about tonight. You probably came here with a lot of questions. You probably will develop questions as we go. Please save them to the end, at the end of the conversation. We've saved about 20 minutes for your questions, so keep them ready and ready to go. And so without any further ado of us, I give you Dr. Mansu.
Okay, good. I think I have it. All right. Again, thank you very much, Professor Sampson, for inviting me to be the person to be asking our mayor all of the questions. I actually wondered when I was asked that I will be the one. I asked myself the question, why me? Because we have so many Wagner students in this area. But then I also remembered that my name is Moses. And Moses, when you're Moses, you're always given assignments. And so I quickly came to terms with that. I left Wagner 23 years ago. 23 years ago. So you can do the math. Professor Sampson, I'm not sure what is in Wagner. I ran to a classmate who works for the Department of Finance. And he saw me and said, Moses, you haven't changed since you left Wagner. And I said, Howard, you haven't changed either. So I am saying this to say that, yes, we may have obtained our diplomas here, but I think there's something also in Wagner that you gave us that we didn't even know about, we didn't bargain for, which is when you come to Wagner, you stay young. Yeah, so that is the secret of coming to Wagner. So don't hold me to my word, but I have a feeling that in 23 years, you still remain the way you are. Having said all of that, I just want to also thank the mayor personally, because I've been in public service for over 23 years now in New York City government, and he was the mayor. And one day I received an email that I was being recognized in a special category for excellence in customer service. So I never got a chance to thank the mayor, but when Professor Sampson said for me to come, I truly was happy, because then I will get the opportunity to say thank you for recognizing my public service. At this particular stage, I think we are going to, because of time, we are going to I'm going to hand you over to the mayor. He will give his remarks, and then we'll go straight to the question. So, Mr. Mayor.
All right, thank you. First of all, everyone, I'm very, very happy we're gathered here, because this is an extraordinarily urgent question we're talking about. And we just went through the pandemic, or are still going through the pandemic, and one would have thought that would be all we would need to know about inequity and disparity in healthcare to generate lots of very tangible and immediate change. And I don't think anyone in this room is laboring under the illusion that that has happened already. We have a golden moment. We have a powerful moral moment that is not being acted on sufficiently. So this topic couldn't be more powerful and timely. Professor, thank you for leading the way on this and giving us this opportunity to talk about it. Moses, thank you for the great work you're doing and you've done for New York City. And I know this has been a passion of yours. A passion of mine is making sure there's anyone in the room that they are not out of the sight line. So there's seats here, or just everyone, if you can't see the speakers, come closer.
I think your mic.
Is my mic working okay?
You may want to press it again.
I'm trying again. Oh wait, it keeps.
Yeah.
It's Shannon. My mic is rebelling.
So
it's like it's doing multiple
that's what
colors.
it's doing.
It's kind of cool.
Just press it once and it works.
Okay. Okay. Let's try again. All right. So, thank you everyone who moved. I really appreciate that. It's very strange when you're in a room and people are far, far away, and it does not build a sense of community. And to address these issues, we surely need a sense of community. So, I'll say something very quick to begin, and then I look forward to the dialogue. The disparities we're facing can be addressed. I think it's really important to start with hope and possibility. I've been in the belly of the beast, as it were, at the front line of trying to address a whole range of issues. And what I found was there's a lot that can be done. The tools, in many cases, are there. The history, the habits, the culture of certainly a lot of government agencies do not lend themselves naturally to change. They are agents of the status quo on many, many levels. But the tools are there. So I want to make sure I'm stating my point precisely. Just because so much of government has reinforced the status quo does not mean that the same tools that government has cannot be turned to the task of changing the status quo. And my central hopeful message from my own experience over 8 years, and there were 8 very challenging years, is I was pleasantly surprised, sometimes even shocked at how much could move and how much could change. And how many people were anxious to be a part of that. I look back now from those times and now being in the confines of academia where you think bigger thoughts and see more clearly and are more reflective, and I see opportunities we grabbed onto and opportunities we missed. I see things we did well and things we didn't do so well. I see things we understood and things we didn't understand as well as we should have. But all that being said, it is striking how much is waiting there to be done that can be done. I'll talk in the Q&A and the dialogue about things like our initiative to create a guaranteed health care strategy for New York City, which, even though it did not get somehow, in my view, I still don't understand how it didn't get a lot more attention, but it was literally based on the notion that anyone who did not have insurance would still get health care coverage, or we would help them find insurance that worked for them. Crucially, that meant 500,000 of us who are undocumented had a form of health care made available in New York City, which is legally not the case under our health insurance system and is practically not the case in much of the country. One example, the example during COVID of the test and trace core and what it could be brought into non-crisis times, the notion of creating a public health corps and recognizing that so much of what has to happen in public health is about meeting people where they live on the ground in their language and helping them to the things they need, government being proactive and engaging rather than, as is so often the case, distant and impenetrable. The very notion of investing in public health, and particularly recognizing what could be with our public hospitals and our public clinics, which for decades suffered unfairly from a negative reputation, despite the fact that over 1 million New Yorkers depended on them for the vast majority of their care. Breaking that cycle and saying this is the place we need to invest, changing that mindset and showing what could happen if the public sector was unleashed to do a more egalitarian form of public health. These are just quick snippets, but to me illustrate the potential and the possibility. The last thing I'll say is, again, about the time we're living in. I've watched these interesting cycles of when people and institutions are more able to see the possibilities of change and able to embrace them. When I was elected, obviously, it's not a state secret. One of the keys to my election was the sense in this city that the more elitist approach of the administration before mine wasn't working for the city. I happened to be at a moment where my values, my message fit. Well, I think, again, if we look at what happened with COVID, we probably have the most concentrated focus on public health that we've had in generations. And not just physical health, thank God, but mental health as well. And one of the biggest challenges for all of us is bringing true parity between physical health and mental health. Well, this is probably the most powerful, potent, open moment for that. But we all have to kind of run into the breach there and make something of the moment. So I won't go on further. I have strong feelings on this topic. Okay.
Thank you very much,
Thank you,
Mr. Mayor, for all of that. We could all just leave it to him and just listen to him. But we do have some questions for him that we want to pose to him. And so I'd like to start off with, to paraphrase one philosopher, Seneca. He once said that if the sailor as sailing in the sea does not know where he or she her destination, if they don't know their destination, then no wind is good. And so with that, Mr. Mayor, I ask you, how come you ended up in public service? What brought you to public service?
Well, so exactly 40 years ago, you would have found me walking these streets as an NYU undergrad. And I was the day I gave my first class in January as part of the Wagner team. I was in a classroom that I very well may have been sitting in 40 years ago that day as an undergrad. Already quite clear about the fact that there was a lot that was broken in the world, and it was the obligation of anyone who could to act on it. And that, without going into a lot of detail or drama, I mean, a lot of that came from challenges and pain in my own family. A lot of it came from seeing a world around me with these extremely sort of watershed moments that affected me, the Vietnam War, the Watergate crisis, a number of other things that kind of brought into perspective for me that there was no choice but to be engaged and involved, and also having seen, and this is sort of to me one of the most frustrating yet somehow still hopeful elements of sort of political life, political science history, is I lived to see all these movements in my formative time. All these movements have a massive positive impact and achieve some of their goals, like ending the Vietnam War. And yet I think, especially for progressive folks, there's sort of this instant amnesia that there's a victory and then it gets forgotten, and there's a sense of being overwhelmed, and that change is hard, if not impossible. So I'm being extremely simplistic as I sketch this out in the interest of time, but I'm saying I came up in a time where I saw change happening, and I believe more could happen. And I still believe exactly that. I am not particularly different from that dude with a lot of hair in the main, what was called the main building then in 1983. So to me, it was organic. And last thing I'll say about it, it was not, I kind of got this at the time, I understand it much more clearly now. It was not about profession. It was about political and personal values being put into action that might correlate to a profession. And it's great if they correlate to a profession. But they don't have to correlate to a profession, and the profession doesn't necessarily engender all of the things that might be your personal and political commitment. So it was very striking to me at the time that the path was activism. If that activism ended up eventually connected to a paycheck, well, that would be really cool. But I did not always assume that. And I want to finish by saying it was just extremely personal and emotional, and I think that's totally okay. And I want to kind of, it's interesting, as I talk to a lot of Wagner students, I understand people learn theory and they think systematically and they think about measurable outcomes and all sorts of good things, Professor. To me, I never got that far. I didn't go to Wagner, sorry. It was personal, it was emotional, it was passion. It was belief system. It didn't have to be as sophisticated as that to fuel a life.
Thank you so very much, Mr. Mayor. And you have become a consummate public servant. Let's applaud him for that response. The other question that I have for you, Mr. Mayor, is you came to office in 2014. After running on a very compelling message of a tale of two cities, making it very clear that addressing both historic and contemporary inequities will be your focus. We know that due to certain policies and practices over decades, there are now differences in life expectancy, disease burden, and many other indicators based on just zip codes, and none of which is based on genetic differences. Could you please tell us about that vision to dismantling this centuries-old legacy, including your personal understanding of the outcomes, differences in outcomes based on residential neighborhood? What did you do as a mayor to level the field in terms of these two cities' tale?
I think for my team and I, there was a very clear sense that we had to think about profoundly, structurally altering the city to address inequality. And we also had to have an honest and practical understanding of, on any given day or any given year, what we could and could not do. Because I think there is a tremendous error if there is not an aspiration, a very sort of difficult, lofty aspiration. I think being so pragmatic that you can't dream the dream is dangerous. I think being such a dreamer that you can't accept incremental change and improvement is also dangerous. So it was very, very interesting, very organically, a group of people gathered together over time. It's too simplistic to say pragmatic progressives. I think that kind of has become a bit hackneyed. I would say it more so change agents who did not dwell in pure idealism. Very intensive change agents who were always looking for the next opportunity, but had no illusions about what we were up against. And I was deeply affected. I worked for Mayor Dinkins I was deeply affected by that experience, seeing both a very good person and a very good agenda just surrounded by oppositional forces and kind of strangled. So I got a kind of girding or armor from that and other experiences that said to me, this is not going to always be fun and easy, no matter how noble we believe it to be. And so let's be very systematic about what we can and can't do. Our best chance is to push the buttons of change we can, and people will see that, and that will fuel more. That will provide the political capital and the momentum for more. That was the thinking behind doing pre-K for all very early. That was the thinking behind doing paid sick leave very early. Focusing on affordable housing from the beginning, ending stop and frisk, settling the Central Park 5 case. There were a lot of things that we saw that were morally right, substantively right, that could make an impact. Did I believe these things added together ended inequality in New York City? Not even close. I was quite conscious of how rich and deep and powerful the strands of inequality were. I was quite conscious of institutional racism and just power, plain old power dynamics, mitigating against change. But we were able to find the beginning. I think that's the way to answer your question. We were able to find the beginning. One of the things I loved about pre-K for all was it set dominoes in motion because it added to the expectation of equality. It added entitlement and empowered the notion that government was supposed to do more for people. Obviously, for each kid, for each family, it changed circumstances materially, and for children, opened up the potential of a more equal future. But that was one of many, many things. The residential dynamic, to conclude, the residential dynamic, when you look through that prism, it is daunting. Housing discrimination, economic inequality, all of these different strands you can look at that have created the map of New York City and the map of so many other places. You're not going to undo them with a single policy. You're going to undo them with decades of multiple policies layered on top of each other very intentionally and aggressively. And so we understood we could not create perfect equality in our schools anytime soon, but we could create a piece of equality, for example, pre-K for all. We could not create perfect equality in public safety and policing, but we could take away a negative that was fueling even deeper inequality in stop and frisk, et cetera, et cetera, et cetera. And understanding what you could grab right now and what you could build on, and knowing the idea was to pass the baton for more and more progress thereafter.
Thank you very much, Ms. Mayor. I do have another question. And in 2017, as I received my special recognition from your office, all I could think about was the hundreds of faith leaders that I worked with in churches, in synagogues, in mosques, and everywhere else. Many of them were facing their own challenges, yet they were always willing to partner with you. Do you have any memories that you would like to share of the ways faith leaders in the city have risen to the occasion to contribute to your vision of equity in health? And how do you think community and faith-based organizations can better be integrated into the public health systems?
Well, first, thank you, because I know you devoted so much passion and energy to creating a healthier city through engaging community leaders and especially faith leaders. And that is an area that has often been missed and overlooked. And I know you were one of the innovators who started to change that. So I want to thank you profoundly for that. Look, simple entry point, I'm going to be very quick here. I didn't grow up in a faith tradition. But 2 generations ago in my family, my grandfather's brother was one of the priests in their town in southern Italy near Naples, very small town. And obviously if you're a priest in a small town, that's a really special thing. But my grandfather was kind of anti-clerical, to use the phrase that I think a lot of you have heard. Sort of, he was very critical of the church apparatus and history. And so apparently, even though he loved his brother, my grandfather would not set foot in a church. It's an interesting kind of, like, I believe we all receive a lot through our families and our cultural traditions. So if my grandfather wouldn't set foot in a church, even though he loved his brother who was a priest, I think that's sort of a distillation of some of what I received in thinking about faith in our society. I understand separation of church and state, but I also have a tremendous respect for all the faith traditions. And I understand folks who have had bad experiences, bad histories foisted upon them by some of the realities of faith traditions and their apparatuses. I also see currents of social justice and compassion and charity running through a lot of faith traditions and a lot of individual houses of worship and their leaders. So feeling those kind of different layers, I felt as a progressive and someone who believes deeply in the role of government that there was no sin, if you will, in deepening our connection to faith leaders for the purpose of reaching more people, whether it was with public health information or vaccination drives or testing in COVID, or a very powerful effort that my wife Charlene led on mental health, specifically focused on the faith community, on the very, very powerful, fair assumption that the stigma associated with mental health was so thick and challenging, and so many people were suffering because of it, that we needed to bring the most powerful voices, trusted voices, transcendent voices in each community into the battle to help people get the mental health care they deserved. And what would be more powerful than clergy speaking about mental health? What would be more destigmatizing? So Charlene and her team created a really powerful vehicle called Weekend of Faith, and we had thousands of houses of worship the same weekend in this city agreeing to speak about mental health as part of their service and encourage people to recognize and be comfortable with the challenge and get the help they need. And government could not do that alone. So I'll conclude by saying, you could have a very long, fascinating kind of Wagner conversation about, the pros and cons of heavy engagement with communities of faith. And as a progressive, I would warn people that because conservatives have tended more to want to embrace the structures of faith communities, sometimes progressives have had a knee-jerk reaction the other way. I think that's a fundamental mistake. I was very deeply affected. I got involved in the movement to stop American intervention in Central America in the 80s, got very deeply affected by the liberation theology tradition of Latin America, which is as progressive as it could be. Obviously, the civil rights movement in America in the 50s and 60s, grounded in church communities. It's really important to think this equation through, but especially if you care about public health, we cannot leave faith communities out of the equation.
Thank you again. Thank you, Mr. Mayor. And I know, talking about public health, you are one of the mayors in the city who faced the most public health challenges. You had Zika, you had Ebola, and you had COVID. Many others I'm not mentioning here. But bad as COVID-19 was in New York City, it could have been worse if your approaches were not working, particularly in communities most impacted, communities of color. What would you say were some of the lessons from addressing the inequities in COVID-19 that we can apply to other inequities in other public health threats that are yet to emerge?
Look, I would say this is sort of like a flashback I keep having, that within a few weeks of the crisis really hitting, it was so clear that we were structurally broken in terms of our approach to public health, because it was about communication and information and connecting with people in their communities on their doorstep with trusted messengers, and our healthcare system just wasn't built that way. So, you know, we all could have said that before we ever heard the word COVID. We all could have probably said there's a disconnect here. But COVID made it so material and painful and sharp. Even in the first weeks, it was quite clear that huge numbers of New Yorkers weren't getting the information they needed, the support they needed, the guidance that they could hear and act on. They didn't know where to turn. They were, as we all saw with every passing week, starting to get a lot of misinformation. And healthcare was at the hospital or at the clinic. In fact, a lot of the governing philosophy in the beginning of COVID worldwide was to protect the hospitals at all costs, not let them collapse. On the theory that folks, not unfair theory, that folks who were very sick could be saved if the hospitals were still operational, but if there wasn't a very intentional effort to protect the hospitals, you would literally have thousands, tens of thousands, hundreds of thousands of people who died who did not need to die. And that was not unfair, and thank God some of that was the governing philosophy, but there was a double-edged sword there that it missed the sort of preventative possibilities of a truly assertive and grounded public outreach effort. So what we later came to experience with test and trace, you know, COVID hits in March, test and trace is developed in June. By September, I had come to the very clear conclusion that we needed to make test and trace permanent and have a public health core in New York City. And there are models, and Cuba is one example of this, where there's a very proactive, grassroots approach to providing healthcare. It's not perfect, but it's a model that we need to borrow from and create our own version of. But the absence of that meant that so many of the other things we were doing could not succeed. They just couldn't. And I will finish by saying and I'm keeping the answers very quick because I want to open it up to maximum engagement. The public health team, I had an extraordinary experience with a lot of my colleagues. And there was a tension for particularly the first year between health folks trying to apply what they believed was good philosophy and practice, and everyone else who worked with people out in communities trying to balance the sort of pure health theory, as it were, health policy theory, with human reality and a bunch of other factors, economic and cultural and many, many other factors, familial. And I remember one day I had a really great conversation with my health commissioner, Dave Choksi, toward the latter part of our time together. And he was about as well-trained as anyone could be who got to his role, about as earnest and sincere and effective as you could possibly imagine, but communications and message and sort of thinking about how you move large masses of people in their hearts and minds was not really that much of his training. And to his great credit, he said, I now understand that I couldn't do my job unless I started to learn and understand those skills too. Ironically, Dave Choksi became like a total public rock star because we had him in probably like $50 million worth of advertising. So it became very popular. But I think the boil down of that is we've got to think how to teach subject experts to think like generalists too. And we got to teach generalists to better hear subject experts if we're going to reach people in the kind of time frames we often have to deal with.
Thank you so very much, Mr. Mayor. And this is the last question, and I know time is of essence here. So I ask that in 2014, your administration declared racism as a public health issue. There's no denying that in an expansive city government like New York City's, racism will show. How did you, as mayor, address this problem within city government? Were there any internal reforms that you instructed? And if yes, was it across all city agencies that you had authority over?
That was the goal, and I think it's fair to say we saw You know, a lot of progress some places, less progress other places. To me, it was an article of faith that we were dealing with a structurally racist dynamic. We were also dealing with a structurally classist dynamic. And I am from the school of thought that says, you know, economics, race, culture, everything interconnects. And I believe that the best things we could do are the most material things. Because it's not shocking, and I love all policy people, but it's not shocking that policy people can really talk well and a lot, and sometimes lose track of the material. And it's not shocking because if you have that level of expertise, I think the bigger thinking, the bigger debates, and the perfection of policy kind of draws you in. I respect it, but I also see a danger in it. That what really matters is the material and what reaches people on the ground. So my attitude is if we were redistributing resources, we were addressing structural racism. So whether it was raising wages and benefits of working people, which obviously disproportionately help families of color, whether it was free K for all or free after-school programs in schools, whether it was shoring up and supporting our public health system, all roads kind of led to the same place. There had been, structural racism to me got to be a very economic mathematical equation very quickly. Folks who did the work were not rewarded. Folks who built so much of our society, of our city, didn't get their fair share of the rewards and the riches. So if we were doing systematic redistribution, we were going at that problem. Was it perfect and even? No, not at all. But it was substantial. And then we tried also to address some of the structures of the agencies themselves. Tried to put very clear and enforceable guidelines in place about the diversification of leadership according to race and gender. Tried to ensure that resources from the city, the billions and billions of dollars that the city spends every year, businesses of different types, that was heavily focused on businesses owned by people of color and women. A lot of those kind of procedural structural pieces were important, and I think we were able to get something done there. But my foundational desire was to move resources quickly into the hands of folks who had not gotten what they deserved, and knowing that if we did that, it would be very hard to undo. So there was both an immediate goal, but also a sense of sort of moving the goalposts, and then it was going to be really hard to put them back where they were.
All right. Thank you. Thank you so very much for answering these questions. Now, we're going to open it up to all of you to ask questions. And I, as the moderator, by the powers vested in me as the moderator, I will determine, when to cut off. All right. So we're going to open it up for questions now. I see a hand up there. Yes. You need a mic?
Yes. Okay. Yes, you need a mic. Always take a microphone. That's my advice.
Hi, Mayor de Blasio. My name is Ganesh Ram. I am a nurse practitioner, a doctorally prepared nurse practitioner that worked during COVID-19 on the front lines of the pandemic. And what we saw then, so my question is actually two-pronged, if you will allow me, but what we saw then was that there was a disproportionate amount of Black and brown people that died from COVID in New York City. There's still a disproportionate amount of Black and brown people that still die every day in our healthcare system. How would you recommend bridging that gap so that we give these people accessibility to care?
Thank you, first of all, for serving on the front line. I mean, I don't have to recite how difficult that was. I think people have a sense of it, but I admire and appreciate what you did.
Thank you.
Let's start with leadership and personnel. I think one of the best things that we can do to break down disparity, inequality, structural racism is to make the leadership structures look like the people being served and the people who are the majority. This is a city that is 2/3 people of color. A lot of our institutions' leadership doesn't reflect that, and that can be addressed systematically. So I think that is about demanding of all leadership structures that they diversify, but also that we provide the financial means for people to go into the work. One of the things Shirlane, my wife, focused on was that, you know, we want mental health services to be available to people of color. We need a hell of a lot more people of color being empowered and supported to become mental health professionals, because there's a vast gap, and that actually affects care profoundly. The ability of the practitioner to understand the person they're serving and for the patient to feel comfortable and supported. So I think one of the most foundational things we can do is invest in a very different approach to how we people these institutions. I think the other reality is to take some of the things we started, like guaranteed healthcare initiatives, like investments in health and hospitals, our clinics and public clinics and hospitals, but layer it with a much more profoundly proactive approach. So again, forgive me when I'm a little repetitive, because I really think this is the way. Until we have a comprehensive, universal, national healthcare system, and I think that day eventually will come, because it has in the rest of the industrialized world. So even though we're special, I think that's where things are ultimately going. But until that day, we have to build a lot of the strands that would ultimately give us. And we will not get a health equity in any way, shape, or form for immigrant communities and communities of color unless it is built proactively and with a grassroots apparatus. Just will never break through without that.
Thank you.
I had a follow-up question.
Well,
I'm
there's a
sorry,
lot
and
of
I'll be
people,
very
though.
Quick. I'm sorry.
There's
Yeah,
a lot of people. Go quick.
Just from this perspective of during the pandemic, I will tell you that a lot of the healthcare workers, even that I worked with, they felt neglected. So when we talk about health equity, it is more than just the patient. So recently in New York City, we had the nurses' strike, you know, that we were very instrumental in organizing. Where do you think it stands right now, where how we show our appreciation to our healthcare workers, of what can we do as a state to make the conditions that they work in more tolerable?
We're in a structural imbalance. Starting with healthcare, I'd say education is right behind it, where we, you know, it's not just salary, although salary is important. It is working conditions, it is hours, it is a sense of whether people are sort of pushing a boulder up a hill that they will never reach the top of. We are going to have a profound crisis of lack of healthcare personnel. If it's true, we always have. It's about to get potentially a lot worse. It's going to take a massive investment. The investment is there to be had. If you look at the costs of our foreign wars, if you look at the costs of our tragic tax cuts for the wealthy and corporations, no one can tell you there's not money that could be applied to the task. But this is going to be a different era in our history. It's actually going to be the first, arguably the first time in our history that there isn't an organic increase in the number of people going into these professions. And again, I'm paralleling healthcare and education, where, you know, right now, this just real quick, at this moment in history today, this minute, we've had the most people educated in the history of the United States, because more and more education, the availability of more and more has been this upward curve since the beginning of the Republic. And for the first time, that is being threatened by economic conditions and the cost of education, but also people are making choices now that might be taking them away from those professions. And those professions, therefore, need to be made a lot more appealing, and there has to be a lot more support for education, and it has to be almost a national mobilization to ensure we have the people we need, just like we would mobilize in a different way in a war to make sure we had the soldiers we need. We are going to need to have a systematic effort to have enough healthcare professionals and educators real soon, or there's just going to be the first time in our country kind of consistently where people show up for care or kids show up for schools and there's no one there.
Thank you very much, Mr. Mayor. Yes, I see a hand there.
Yes, hi. I'm actually a proud 1983 alumnus of the Wagner School, so I'm very happy to be here, 40 years. And I'm also actually a neighbor of you, Mr. Mayor. Just about 2 weeks ago, you were on the bike next to me in the YMCA.
That's
But
right.
my question actually has to do with a third status that I have, and that is I'm a proud retiree of the city of New York. I'm one of about 250,000 retirees and their dependents. And what they want to raise tonight, and I think it does go to the issue of health equity. You are, I'm sure, aware that the city of New York currently, and it began, frankly, while you were mayor, is attempting to force all of its retirees into a Medicare Advantage program, which, frankly, the retirees who are aware of what's going on do not want. My own personal opinion is the whole Medicare Advantage program, you mentioned before about a national health plan, it seems to me it's a step back. I mean, it's an attempt to privatize Medicare and turn it over to insurance companies, essentially. So my question is why, I mean, I'm assuming since it started under your administration and the current administration is still fighting it, that we beat them in court in 2 cases. But it still goes
I'm
on.
ready to answer. Why did we do it?
I've said all that I need to say. I guess
Why
I'm
do we do it?
interested in
Yes,
your,
it's, and I appreciate both the question and the critique. We did it because I became, with my team, increasingly convinced that our healthcare benefits for retirees were deeply threatened going forward, that we were getting to a structurally imbalanced situation. Now remember, we are one of the most generous places in America by far in terms of rightfully providing pensions and healthcare benefits to the folks who work for us. I think that should be the norm in this country. You know, it is the rarity, unfortunately. We have a lot of retirees. Thank God people are living a lot longer. The economics of this were getting really dangerous from our assessment that if we didn't figure out a way to make it economically sustainable, we would get to the point where the program might not be whole and people would suffer. So we went to the labor movement, the people who represent the workers of this city. We're not debating. We're not debating. We went to the labor movement. I'm just going to do my facts and let it be out there. You're fair fight. We went to the labor movement and worked through this equation and talked about the problem and the challenge, including, again, what would happen if we didn't have the resources to provide health care for people down the line, and came up with this solution. I'm in the same boat. My family will depend on the same health care. I believe this was better than leaving the status quo in place. I don't know where this is going. If this debate and this process leads to a third path that wasn't previously considered, you know, I for one would be open to that too. But what I would caution is the path we were on was more dangerous than I think people recognized, nor was there an honest conversation, truly. No one's fault, but I'm just giving my reflection. There wasn't an honest conversation about the fact that what we had today was not necessarily going to be viable tomorrow.
Thank you very much. Thank you very much. Yes, 2 more questions, and I think, I see many hands here.
More than 2
All
more
right,
questions. I'm
you,
a rebel.
you go first, and then you go next. Yes, yes.
Hi. Thank you for your service.
Thank you.
I'm a frontliner OBGYN at one of the public hospitals, but been doing that my whole career. Please, for me, expand upon the ideal of how you foresaw the test and tracing core as a public health core to address, obviously, the upstream inequities that my patients face. So just expanding on that ideal to utilize it in the future for other things, not only another pandemic, but just other things that we can be addressing forthrightly
Yes.
in a preventative model.
Amen. Thank you.
Thank you. Thank you so very much.
First of all, thank you
Yes.
again for all you do and for the choice you made in your life. I mentioned before, and this is going to directly get to the point you raised. I mentioned before that I was involved as an activist in the 1980s in the movement to stop American intervention in Central America. And as part of that, I went to Nicaragua during the initial Sandinista government and went on a tour of different community centers around the country, and I was in the city of Masaya, and we were at a health center. And I was not an expert in any way, shape, or form in healthcare. So I was actually, in a way, experiencing very purely a different model without any assumptions. And the head of the health center showed us a map of the neighborhoods of that city. And I was trying to figure out, it was color-coded a certain way, and I was trying to figure out what it meant. And she explained that it was showing where they were on their progress of reaching each door of each home in the city. Because their interpretation of healthcare, again, largely aided by training they received from Cuba, was that healthcare is, I go to your door, I'm a healthcare worker of some kind, I go to your door and I talk to you about your life and your family and what you're experiencing and what you understand about healthcare, what you don't understand, what you need and don't have, what you are trying to understand. I educate you. I try to address your immediate needs, try and figure out what can help you in the long term. And that was in an impoverished country. That was literally before cell phones were in wide use or the internet was in wide use. And it was very people to people. And you know, even with what they didn't have, they sure as hell knew how to organize it and do it on a systematic basis. I remember very vividly that the health center director said one of the biggest challenges they had was trying to help people understand not to burn their trash in front of their front door. And if anyone in this room for a second was like, oh my God, you know, how undeveloped that is that people would do that, I'd like to remind you there's a thing called burn pits on US military bases in Iraq and Afghanistan. So in just the last few years, we repeated the same exact bad public health strategy, but did it through a massive, sophisticated organization. So I think I've given you enough of the context to say I had been very moved by that and didn't know what to do with what I was moved by for years and years and years, and then along came COVID, and the notion of test and trace was an established notion, but it was not in general thought of as something that should be really ubiquitous and widespread. And so we decided, why not take it to a much higher level? We hired between 4,000 and 5,000 people, and we saw the extraordinary impact and the incredible compassionate work that people were doing. And we hired from the communities most affected. And it was not a big jump to say, well, wait a minute, why should that not be a permanent feature? Because that would be an incredible defense against the next pandemic. But also think of whatever health challenge exists in any family, particularly less advantaged family in this city today. Imagine what that dialogue on a regular basis could do to change their circumstance.
Thank you so much. There was a question here, and I know time is running out. I will try to manage it. Want to hear from you.
Two more questions. Carl, I'm just going to be
This is very exciting.
So difficult.
Yes.
I'm going to start a strike against the school that we're not allowing more questions. Go ahead.
Yes, please go.
Hi, Mr. Mayor. My name's Barry. I finished at Wagner last spring. I don't do anything as noble as the people who asked questions before, but I work in political consulting, and a lot of times we're helping companies and associations and nonprofits navigate state and city level systems. And what I've found, and this kind of started during my time at Wagner, is that while conservatives have typically deregulated and cut procedures for the sake of limiting state power, in a lot of blue states and cities, over procedure and too much regulation has, in an effort to be democratic and include more voices in the process, has been captured by corporate interests and has limited bureaucrats from accomplishing a lot of the progress and the things that you have talked about today. So how much is progress towards a more equitable future in terms of health from investment, and how much of it is from allowing a more dynamic government through sort of taking a lot of the lawyers out and
I'd like the lawyers to leave the room for this question here. I would say it is much more the investment side of the equation, because we have not even begun to invest in a real way. But I understand, I think, part of what you're getting at. I would equate the barriers that are either legalistic or bureaucratic as going far beyond corporate influence. I think some of these government came up with all by itself, and humanity came up with all by itself. I don't, once upon a time back during the Roman Empire, someone came up with like bureaucracy as a concept, and we've never been able to shake it. And so I do think there's a culture problem inherently in most bureaucracies. Interestingly, I think there's much more possibility of overcoming that now because of the kind of generational changes and consciousness differences that we experience now versus even just a few decades ago. The amount of information, transparency that's being demanded now and is available. I think a lot of that can be overcome. I think the more important equation underneath all of that, whether it's investment, bureaucracy, culture, laws, is the political one, because that's what will set everything else in motion. The political circumstance is extremely open. Even with its problems, it's extremely open right now. And not only was I not supposed to be elected, I was not supposed to be able to do some of the things I did, and I was stunned how possible they were. And it's because a lot of the previous structures of power have corroded. Once upon a time, I spoke once. I don't want to say anything ill about someone who's passed away and did some good, even though I disagreed with him on many occasions. But a major political leader of this city, who talked to me about his understanding of the power of the Wall Street sector and the real estate community, and sort of how elected leaders had to respond to that. Well, that may have been true in some ways 40 years ago. By the time I came along, it was an entirely different dynamic. And I don't want to stereotype the real estate community, for example. There's all sorts of different values running through that community, and people I agree with, people I don't agree with, but the real estate community as an organized entity was rabidly opposed to my election, and it made no difference. So the reason I say that is I think the things that might have blocked a more egalitarian approach to government, a lot of those are not there right now in New York City in particular, and in large measure New York State and a number of other states. They're certainly there nationally. But you couldn't have said that a few decades ago here. And I think we have not fully grasped that in terms of our actions. Could we do a few more, please? Please? Two more? You call that a compromise?
Okay, three.
27 more.
Okay, I'm told two more. Two more.
Three? No, she agreed to three.
Yes. Okay. All right. So, go ahead. You had a question? Okay, go ahead. The conversation is getting so nice.
Right. That's why we shouldn't stop it.
Thank you. First of all, thank you for your service,
Thank you.
Mayor Blasio. I remember many years ago, I think when you were still going into being a mayor of our city and we were hit with the Sandy crisis,
Yes.
I had heard you speak at one of the nursing homes that you would come in Brooklyn.
Oh, thank you.
So since then, it obviously put a great impact on me, and it has paved a lot of the things that I think about public health. So lessons that learned then, coming into obviously one of the biggest public health crises globally during COVID, what were the lessons learned, and what do you want to probably tell us about like how to work towards social determinants of health, especially moving into that geriatric population, because of which like a lot of times when social determinants of health are not really navigated, that also puts them in those nursing homes. So what were the lessons learned, and basically just how would you like tell a mid-careerist to like go about those things?
I mean, I think the big lesson here is redistribution of wealth. That is so much of what you can do to counter the problems, from the social determinants, but I also don't think it is valuable to be overwhelmed by the structural reality of the social determinants of health. When I hear the phrase, I think right on, we're having the right conversation, and then I immediately get fearful that folks will, as one of my former commissioners used to say, will admire the problem, because it is so deep and intertwined, you could give up immediately. If you said, well, why are some people like perfectly healthy and have everything they need and other people have essentially nothing they need, and what are we going to do? There's so many reasons for that none of us is going to fix that all. But we can fix a lot of it, and we can fix pieces of it, and we need to move aggressively, and that's about moving resources first and foremost. I also think changing our assumption of what healthcare looks like. In COVID, we saw the power of the grassroots, test and trace. We saw increasing ability to get people to embrace telehealth. There's a powerful movement growing around this country to ensure that folks don't go to nursing homes but stay at home and get support, including from their own family members, with financial assistance. There's a growing movement in this country to provide hospital care at home, not in a hospital. This is the shape of things to come. And I think the way to address these issues is not to say, hey, can we flip a switch on fundamental inequality in America? Not as much as we'd like to, right? We should keep going at it. We should raise taxes on the wealthy and corporations. We should provide a lot more support for folks who want to become professionals in these fields. We should profoundly change our education system to reach children earlier. There's so many things that would, piece by piece by piece, undermine that imbalanced equation. But that's like the work of decades and generations. In the here and now, you can still reach a hell of a lot of people with some of the strategies I just mentioned. So will you be able to say, wow, I slayed those root causes? Not as much. But can you reverse the impact of the root causes for a lot of people? Yes.
Thank you.
Thank you so much. One last question.
17 more questions.
I'm gonna. One last question. Who?
Wait, no, we agreed on 3 a moment ago. That was one of 3.
If
more.
I'm about to lose my role as the moderator, so I am going to exercise my power here. Whose hand is there? Yeah, please get a mic.
Hello. Hi. My name is Matt. I'm a graduate student. Of all the programs and policies that you initiated and set a foundation for, which ones do you feel like will have the longest lasting systemic and cultural effect on New York City? And which ones would you like to see survive?
I think the things that have a multiplier effect, clearly that is early childhood education. It's a powerful thing unto itself and in the moment, but it keeps growing in its impact. Clearly, changing the approach to mental health, which we only began, but at least I believe we showed you could start to change, turn the supertanker, as it were. Because if you really could get the right conversation going on mental health and start to move resources and policies with it, you are going to change homelessness, you're going to change incarceration, you're going to change school dynamics. That's why we put as much as we did into mental health, but we had nowhere near the amount of time to build out what we needed to. And, again, did some things right, did some things less right. But I think those kind of foundation building pieces are the ones that I am most excited about, and I think that the ripples are already being felt and they're not going to be easily undone. I also think they all could go a lot farther, a lot faster if people would come behind it and sort of go up the next level and the one after that.
Thank you very much. Now, With that,
Under
with-
protest,
with
we
that-
are finishing
with that said,
the
Mr.
formal-
Mayor, thank you so very much. I believe that it has been a very wonderful conversation. I wish we had time to get to all of the questions, but I guess there'll be another time. We'll have another. He's going to be here for the year, so you're going to run into him and ask him all the questions that you have. So, Mr. Mayor, thank you so very much for coming and answering the questions from Wagner students. And I think at this particular point, I am going to hand it
Carlo
over
wants a microphone.
Yes.
That's the international symbol for give me the microphone.
Thank you all, and thank you for your questions. If you do have questions still, there's a reception that follows. You can take that question to the reception and keep the conversation going, because we knew that in doing this, that this would just be a start. There'd be lots more questions that we can answer in our hour. And so this was just the start of the talk, and we want to keep the conversation going. So join me again in thanking our conversants, Professor Bill, I'm going to call you Professor Bill now, and Dr. Mansu. And we look forward to your continued engagement with us and your work as you do everything that you heard today to help with health inequity in our city. All right? Thanks again for coming.
Thank you, everybody.